Yes, this is your card. My name is Martha.
Martha.
My name is Martha. Yeah. So, fine. Second. Yes. So you can start now.
Okay. Good morning, Martha.
Good morning, nurse.
Okay, my name is Akshaya Shogan. I'm one of the resident nurses working in this clinic. I know you are here to remove your stitches and wound cleaning. Am I right, Mr. Martha?
Yeah, you are absolutely right, nurse.
Okay. Okay, definitely I have to provide the proper care. But before moving further, do you have any specific concerns regarding your present situation?
Yeah, of course, I'm worried. The doctor told me that I had something called squamous cell carcinoma, which I think is just another name for skin cancer. So I am little bit worried, nurse.
Nothing to be overly concerned about that, Mr. Mata. We are here to help you. I will explain what is your condition and how to manage your condition. Everything I will clearly explain to you. Squamous cell carcinoma is a type of skin cancer. It's caused by some kind of some sun exposure, ultraviolet radiation. Am I clear to you, Mr. Mata?
Yeah, of course, nurse.
And also, I assure you that already your lesions are removed. That is why I'm so happy to say that the cancer cells are unlikely to spread. Uh, how does that sound, Mr. Mata?
Yeah, that's really fine, nurse. I really appreciate your points. But the thing is, I want to know more about this skin cancer. Can you please explain me further, nurse? I want a deeper idea about this.
Definitely, Mr. Mata. I will give the proper explanation regarding this commercial like cancer. We have lot of treatment options are available in this case, like some kind of surgeries and some kind of diagnostic measures. Everything is available. No need to worry about that. But we need to monitor the further occurrence. That is why you have to monitor your skin. Like if you find any kind of changes in spots or like any color change, any red dust, everything. If you find, please let me know. We have to find out any further occurrence of this condition. Am I clear to you, Mr. Martha?
Yes, of course, sir. That's
Then,
absolutely clear.
if there anything else I need to clarify with you, Mr. Martha?
Yeah, I want to know about, I have a better understanding about what squamous cell carcinoma is now. And yeah, I want to know if it is likely for me to have more surgery to be removed, other lesions in the future.
Yeah. Yeah, that is a reasonable concern from your side, Mr. Mata. Try not to worry. I will explain to you because already your surgeries happen, but I'm not an authorized person to advise regarding the further surgeries. You have to talk with your doctor. They will give you more information regarding that. Is it fine for you, Mr. Martha?
Yeah, of course, nurse.
Then, in order to get a better picture about your condition, can I ask you one more question?
Yeah, please go ahead.
Okay, thank you, Mr. Mata. Did you use any kind of like hat or any kind of sunscreen whenever you go for outside?
Yeah, I always wear a high factor sunscreen, 3.0 or higher, and I wear a hat when I'm out in the sun. And yeah, I think it's too late because the damage has already been done, and I spent too much time in the sun in my teenage years.
Okay, well, Miss Martha, that is a valuable concern from your side. Also, I have to appreciate for you what are the things you have to do for your skin care. Everything is fine. Then I would like to give you more information regarding like why we are advising to continue wear this kind of sunscreen hat whenever you go for outside. We have to prevent the further damage. Already you have some kind of health issues, but we need to prevent the further occurrence, further damage. That is the reason we are advising to use these kind of things. Are you getting my point, Mr. Martha?
Yeah, of course, nurse. That's very clear.
Okay. Then, do you have any kind of pain or discharge, anything in the surgical site?
Yeah, I uh, don't have any pain actually, and there is
Mm-hmm.
no discharge. The wound is fine, and I'll make sure to look after my skin from now on.
Mm-hmm.
Yeah, but I think it's too early to have the stitches out right now, don't you think, nurse?
Oh, well, Mr. Martha, try not to think like that because you are already tell that like that you don't have any kind of pain and discharge, anything like that. And also your wound is assessed by the doctor. They will advise for the stitch removal. And also we have some policy after stitch, like after the stitch, we have to remove the stitches within 70 to 14 days. It's already done. That is why the doctor advised to remove the stitches. But make sure that Mr. Martha, if you remove the stitches, you have to keep your wound clean and covered and dry. We have to prevent the infection. That is why. Can you do that, Mr. Martha?
Yeah, of course, nurse. Definitely, I'll do that one. Okay, if that is the case, then okay, you can have my stitches removed.
Okay, thank you for your willingness, Mr. Martha. Please wait. Within 2 minutes, I will arrange all the things for your stitch removal. And I wish you have a nice day. Thank you, Mr. Martha.
Yeah, thank you very much, nurse. Fine.
Okay, thank you, sir.
Yes.
Some kind of things,
Yes. Okay.
some problems is this.
Right. Now be silent because I'm going to give you feedback. And
Okay, sir.
yeah, I'm muting everyone. So next, who wants to take the speaking session? Soumya or Omote? Who wants to take the speaking? The speaking sessions are for the regular students, registered students, those who have subscribed for the classes. So others can participate and attend the sessions. Right. Here, this is Akshaya Ashokan from Kochi, Kerala, India. This is a speaking session, nursing specific speaking session. Yeah. So those who are attending and those who are already on the platform, Keval Shah, Omote, Soumya, if you are available, you can write your name and send a message to me on WhatsApp. So I'll schedule your next speaking session. So if you request only, I'll give you the session. So request me on WhatsApp. Uh, Coming to the point, Akshaya, yes, this is a nursing specific speaking task, and she is preparing for nursing specific OET. And the case is squamous cell carcinoma. Squamous cell carcinoma. Yeah. Yes, Omatoyo is a squamous cell carcinoma. Yes, next is your turn. Omatoyo. So, number two is Omatoyo Toin. Be ready. Yeah. So, Akshaya, I have noted some points what you are speaking. So, you said Mr. Martha. So, Martha is a female name. Okay, sometimes it may be confusion. So, if you are not sure whether it's a male name or female name, you can definitely ask. So, Martha is a lady's name in general. Who knows, maybe man's name also. We don't know. But you can ask whether it's a male name or a female name. Yeah. So, and this Mr. Martha, you have repeated this word time and again, maybe 10 times you have used in 5 minutes. It's a too much repetition. It's a too much repetition. That much repetition should not be there. Okay. So don't repeat the name. So you know only I and you both are there. You on that side and I on this side. So there is nobody else. There is nobody else. You that side and I this side. So why are you telling Mr. Martha every time? Do you think that I forgot my name and you are reminding my name? That's not the case. So there is no need to multiple utterances of the name. Okay, here and there, once in the middle, once in the end, once in the beginning. Okay, but more than that is not very, it's not so good. Next, so avoid this repetition. Next one, the fluency is okay and better, but definitely not the best. There are some pauses and breaks here and there. There is some confusion in one or two occurrences, what to speak and what not to speak. You are making up your mind because you are not ready what you wanted to speak. So you are taking 1, 2, 3 seconds, or sometimes even 4 seconds, to design the next sentence. So the thought processing is little bit delayed and you're getting stuck. So this is because you don't have that speaking practice on frequent occasions. Unless and until it is mandatory or necessary, you're not speaking in English. That's the reason. It should be a general lifestyle habit. Whenever there is a chance, flaunt your English. Then only you'll get that fluency and flow of speech. That's what I'll say. Next, accuracy. Yeah, you're doing very well. It's very good. Grammar is fine, excellent. I can say it is 80 to 85% apt. But grammar doesn't mean just being correct. The quality of grammar you are using. Ordinary sentence also grammar is there, but you can join 2 or 3 sentences and make mega sentences like simple, complex, compound sentences. If you take preventive measures whenever you go into the sun, the complications may not arise. So prevention is better than cure. So if condition is used, so it is a complex sentence. You can go into the sun, but you have to take preventive measures. But is a coordinating conjunction. So it becomes a compound sentence. Okay. The next, because of preventive measures, because of preventive measures, you can avoid complications. So this is simple sentence. So how you are improving joining the two sentences is also important. Next, grammar. So how you are playing with grammar is important. Most of the sentences you are using are active voice sentences. You have to be careful. You should not go in the sun. Are you taking Are you using a hat? So you're asking, so active voice sentences. You can use passive voice sentences. Are preventive measures used while going out in sun? Not are you using preventive measures? Are you taking preventive measures? Are preventive measures taken? So this is passive voice. Okay. You should take preventive measures. Preventive measures should be taken. Passive voice. So why do you want to use you? So avoid personal pronouns. Avoid personal pronouns. Quality will come up. Otherwise, you will be telling how many sentences are there, that many use you will use. You should not, you should do, you should take, you should come, you should avoid. So this you will be avoided. So it gives quality. Next one, avoid repetition of the vocabulary that you have already used earlier. So repetition is another type of mistake which spreads under the mat like water until you will become wet. You don't see the water, but you will definitely become wet because water under the mat already spread. Just sit on it and you will get wet. So that's it. So repetition, be careful. You will not know that this is a mistake. Avoid personal pronouns, avoid repetition. And third thing you have to avoid is avoid active voice as far as possible. Make use of passive voice, the subject-centered approach. That's how it will benefit you. Next step. Pronunciation. Yeah, your pronunciation is good, definitely. Yeah, we can have a near native speaking. We cannot be native speaking. So our pronunciation will be near native accent. That's fine, no problem, because people can still understand. Then try to learn quality sentences and use them on a daily basis. So do you have anything to say, Akshaya? You can say now. Yeah.
So everything is fine. I can understand what are the mistake I have to make. Everything I can understand, sir. Thank you so much for the correction.
Yes. So that's fine. Thank you.
Thank you,
And
sir.
next,